Hello, my name is Gloria. I'm one of the hospital pharmacists on duty. I'm here to talk about your condition, which is diabetes. Can I proceed, please?
Yes, sure, Glory.
Di- diabetes is i- diabetes is actually it's actually a condition which 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 happened when you have when your blood sugar level goes up. So this leads to diabetes. But with my record so far, I noticed you've not be taking your medication regularly. Please, can I know why?
Actually, most of the time I remember, but someday I just forgot to take it. I think it happened to everybody.
Yeah, I totally understand from your own end. I totally understand from your own end, like trying to, you're like, you always forget to take your medication, but taking your medication, taking your medication and taking it properly will help maintain the sugar level of your condition. Is, is that understood?
I understand, but I think I don't need to take the medications regularly. But sometimes I forget. Like, I don't do it on purpose, but see, I live alone and I have no family to support me. So sometimes I forgot, and I don't forget on purpose. But whenever I forget, I take a double dose to make up for the missing dose. So I think I take double dose, so that's fine.
You don't you don't need to take a double dose when you miss a dose, because when you do that, you are this will lead to a side effect. This and taking a double dose is actually overdose. This is what we call overdose, and so it can lead to several side effects like serious diarrhea, hypertension, and even um, cardiac arrest. And this is what I don't want for you. Is that okay?
Oh, I never realized the side effects could happen with double doses. Hey, Chloe, can you please give me some advices on how to remember medication?
Oh, perfect. There are many ways I can assist you with 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 your medication in the aspect of you not forgetting or to remind you. You can have an alarm. You can set an alarm on your phone. If you do take your medication in the morning by 7 a.m., so you have to set it in the you have to set that alarm every morning 7 a.m. Or if you take it in the evening 6 p.m. or before going to bed, you have to put the time. So when the alarm pops up, it can be on your phone, but it will be advisable for me to for it. I'll be it will be advisable for it to be on your phone because your phone goes with you everywhere. Because if you have an alarm clock at home and you might not be at home at that period, it might ring. You might not get the information properly. That you might definitely forget because when you get home, you'll be able to take it. But if your medication is with you and your phone rings and it reminds you, so you can take your medication. And also there are also a speed bus. This speed bus has different this speed bus has days and days of the weeks on it. Some of them has numbers of the months, 1st of May, 2nd of May, and so on. So I can just put your medication in there. So when you want to get it, you just go straight up and pick it up. So there's no need for you to double a dose or take it wrongly. Is that understood?
Thank you so much.
Yeah, do you have any question?
No, I do not. Thank you, Glory.
Yeah, okay. Mm, I would love to request a referral for an e-home nurse, a nurse that will come around to always support you, to try to check your medication so that you can be taking your medication properly. Is that okay by you?
Yes, I would like to accept the offer.
Oh, perfect. So I'll do that right away. All right. Thank you. Bye.
Can you find the issues in this role play? Let's do it. The opening felt a little hesitant and lacked confidence. There were noticeable long pauses, which made the start feel uncertain. Remember, a confident and warm opening helps build the role play and sets the tone for trust. Let's talk about third task, how the student done it. No, you cannot take a double dose. It is very dangerous. It is good, but it was too direct and sounded judgmental. This kind of tone can embarrass the patient or make them shut down, which we want to avoid. Recycle emoji. A better approach would be to say something like, "Greater than, I understand that you miss a dose sometimes and try to double the dose to make up, but unfortunately, that can be quite dangerous. Taking a double dose can cause side effects like nausea, low blood pressure, or even more serious problems. So it's important not to double up, even if you forget." This approach acknowledges the patient's intentions while still educating them in a supportive and non-threatening way. Now, fourth task. Explanation here was too long and over-detailed about pillbox and setting alarms. These are simple solutions, so keep it brief and practical to save time.